What they don't tell you about liver cancer, the truth you need to hear. Liver cancer isn't something most people talk about until it happens to them or someone they love. Unlike more well-known cancers, it lurks quietly, showing no signs until it's advanced and difficult to treat. That's why it's called the silent killer. By the time symptoms like fatigue, unexplained weight loss, or abdominal pain show up, the damage is already done. But here's the real question. Why aren't we talking about it more? Why do so many people feel blindsided when they get this diagnosis? Take Jonathan, a 48-year-old father of two. He never thought a little stomach discomfort and tiredness could turn into a life-altering diagnosis. No one warned him that liver cancer doesn't always come with dramatic symptoms. Like thousands of others, Jonathan found out too late. Unfortunately, this is the reality for most patients. Only 20% of liver cancers are caught early. Before we go deeper, take a second to subscribe. Hit that notification bell and share this with someone you care about. Raising awareness could save a life. Now, let's get real about something no one tells you. There's a stigma that comes with liver cancer. Because it's linked to conditions like cirrhosis, hepatitis, or alcohol consumption, people assume it's something you did to yourself. But did you know up to 25% of cases have no known risk factors at all? Yet patients are often judged unfairly, carrying an emotional burden on top of their diagnosis. Jonathan described it best. It felt like people thought I was to blame for getting sick. That's what hurt the most. Then there's the treatment, far more complicated than the glossy brochures at the doctor's office suggest. Sure, surgery, immunotherapy, and liver transplants sound hopeful, but access and success depend on where you live and what resources you have, and no one tells you how brutal the side effects can be. Jonathan endured months of nausea, fatigue, and emotional exhaustion. The hardest part wasn't the pain. It was the not knowing. Not knowing if I'd make it, if I'd see my kids grow up. And let's talk about the elephant in the room, the cost. Immunotherapy alone can cost over $150,000 a year, while liver transplants can exceed $500,000. Many families are forced to make impossible choices, sacrificing financial stability for a shot at survival. Jonathan's family drained their savings and even dipped into their children's college funds. Imagine the emotional weight of that decision. The emotional toll is equally overwhelming. Fear, anxiety, and depression hit hard. But unlike other well-known cancers that have large, supportive communities, liver cancer patients often face this battle in isolation. Jonathan eventually found an online support group and said it was a game changer. For the first time, I didn't feel so alone. Here's the bigger picture. Liver cancer is rising, and awareness is the key to saving lives. If we don't start talking about it, if we don't push for routine screenings and more support, this silent killer will keep claiming lives in the shadows. So, what will it take for us to bring it into the light? If this resonated with you, do one more thing. Subscribe, share this video, and hit that notification bell. Let's start a conversation that could make a real difference. Lives depend on it.